Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. Megan Chetty, a Johns Hopkins pediatrician, about the importance of getting COVID vaccines and boosters to kids where vaccination rates are extremely low. She also warns of a tridemic that is coming as COVID, flu, and RSV fill children's hospital ICU beds. Let's listen.
Megan Chetty, thanks so much for joining me.
Thank you for having me. I'm looking forward to this conversation.
Yeah, we really need a pediatric perspective at the moment because we're hearing so much about COVID and booster shots, and we're hearing that not a lot of kids have been getting their COVID vaccines. Talk to me about that. What are you seeing?
Sure. So I work as a general pediatrician, and we can start with where I talk to my patients, really about prevention and protection, and we need both of those together. So the American Academy of Pediatrics and every major medical association and the CDC have all talked about COVID vaccination being the single best way for that protection that I talked about. So to protect people from serious COVID-19 illness. And that is including severe disease, hospitalization, and death. And that really is the primary goal behind vaccination. And yes, as you indicated, we have seen kids have not had an increase in getting vaccines that we had hoped, and I had hoped as a pediatrician and talk about every day in practice. Children 6 months to 4 years old have only about 7% in that age group have currently been vaccinated. The 5 to 11 years old, around 40% have been vaccinated, with about 15% getting then the booster vaccine. And adolescents, 70% have been vaccinated, with around 30% getting their booster who've had the primary series. So really, particularly in our little kids, we are concerned about the low rates of immunization. One thing we've also seen that's corresponded with that is if you look at the hospitalization rates of each of those groups. So the 6-month-olds to 4-year-olds have the highest hospitalization rate due to COVID. And we, really think that one of the main factors is the low vaccination rates.
Those parents waited a long time, and I thought there was going to be this pent-up demand. Are you surprised?
I think it's everyone's personal decision to get a vaccine. I see the importance of it because I see the prevention of the hospitalizations and death. And particularly right now, ED visits and hospitalizations. Right now we are seeing what people are calling a tridemic that's coming, where we really are seeing an early flu season along with COVID, and then a spike in respiratory syncytial virus, otherwise known as RSV, has created a lot of ED visits and hospitalizations for children. And right now we're really reaching a crisis state where in the DC Baltimore area where I practice at Hopkins and in DC Children's, we are running out of beds. We've reached our capacity in children's beds in the hospital and in ICU beds in our area and even in the state, and have had to even ship children out of the state for further care. And so this is also happening in other places in the country. And for my worry, as a pediatrician, I really worry about this. And so really encourage people to get the COVID vaccine because we know that it prevents serious disease, hospitalization, and ED visits in kids, and the flu vaccine also too, my other public service announcement now to everyone.
So when you tell parents about the COVID vaccine, what is their hesitancy?
I think there's a lot of misinformation out there, and I will speak to what I see the benefits are to getting vaccines, and particularly boosters now, since a lot of people who've gotten the primary series are now talking about boosters and what they're going to do with that. So first, as we talked about, the primary goal is to prevent hospitalization and death. And the vaccines are doing a really wonderful job of that. Second, I see is really broader protection. So the fall booster, it expands and diversifies the protection that we have, and particularly against the Omicron variant, which is the one that is circulating now the most. And there's also a possibility that it ensures longer protection than the original vaccine. Secondly, really, there's a prevention in infection and transmission. So meaning that you can reduce the chances of getting an infection, particularly in the first few months. And this is really important for kids. They've already missed so much school because of the pandemic. So missing any day of school is something we want to help decrease the likelihood of. And also missing really other important events that we've also missed so much with time with the pandemic. School events, holidays with grandparents and other elderly residents, Thanksgiving coming up. Another benefit I see is shortened duration of illness. So where before, if you didn't have the vaccine, you may have gotten symptoms for a few weeks, 2 weeks or so. You may have symptoms for 5 days or a week. And that is a big difference, particularly for kids. Again, school loss, parents losing days of work, having to stay home, take care of them. And finally, another area that I see as a benefit for boosters is in long COVID. Studies in adults have shown that there's a reduced risk of long COVID with vaccines. And, they vary in terms of how the magnitude. So some as low as 15%, others as high as 85%. But thinking about that, particularly for kids who would have much longer time with long COVID if they had it, if you think about it across a life course.
Recently, the CDC advisory panel recommended adding COVID shots to routine vaccination for kids. So a lot of people are seeing this as saying that CDC is mandating these vaccines. And I'd like you to dispel that piece of information.
So every year, the CDC votes on the pediatric vaccine schedule. So this is something that's happened well before the COVID pandemic came and COVID vaccine was on anyone's horizon. And one of the things that happens with the pediatric vaccine schedule is what is approved on that will be paid for by something that is called the Vaccines for Children. Vaccines for Children is a federally funded program, and it buys vaccines at a discounted rate that then they can give to children across the country at no cost. So basically, in saying that it's now part of the Vaccines for Children, the federal government, once we stop purchasing vaccines, the funds are almost exhausted right now for COVID-19 vaccines. Kids without health insurance or who are underinsured will still be able to get them for free. So this is a huge, vital move in terms of equitable access to COVID vaccines for children to have it added to the pediatric vaccine schedule. And to dispel the misinformation, which I know we cannot say this enough, this is not a mandate. None of these are mandated vaccines that the CDC has at any federal level mandating. All of the vaccines that states and localities require for schools, that is all at the state and local level, that they then decide what vaccines they'll say are requirements for entry either to kindergarten or later grades, or what they say are not required.
So you mentioned this briefly, but I wanted to come back to it about sort of the pandemic effects on mental health for children. We're going on almost 3 years of not really living our normal lives. And I'm curious about my own children and about the children you see, how they're faring.
So I think the mental health toll cannot be talked about enough. I think for everyone, but particularly on children and adolescents. I work as a general pediatrician, and in the clinic I work in, we serve 90% publicly insured patients, and the majority of my patients are also of color. And, every day I see the huge toll on our patients' mental health. So one thing that I think we also don't talk a lot about is children who've been orphaned and lost a caregiver from COVID-19. At the height of the pandemic, when the most deaths were happening, I did not go one day in clinic without having a child that I saw grieving from losing a caregiver come through clinic. And it was one of those things that is unimaginable to experience it every day. There's work of Dr. Susan Hillis, who has concentrated particularly on children orphaned by COVID-19. And she estimates that worldwide over 10.5 million children lost a caregiver due to COVID. And then that translates in the US to over 250,000 children who've lost a caregiver. And there's really significant racial inequities in this too, and disparities, with Hispanic children being 1.5 times as likely, Black children being 2 times as likely, and Alaskan Indian and Alaskan Natives being almost 4 times as likely, 3.8 times as likely than white children to have lost a caregiver. This is due to the underlying health inequities and social determinants of health. And, this is effects that are mental, physical, and every aspect of children, financial now and throughout their life, and really is something we need to concentrate on and think about how we can help support them going forward.
Are you seeing anything different in this stage of the pandemic when it comes to the mental well-being of children?
Yeah, another thing I see in clinic all the time is just the mental health toll in terms of depression and anxiety that the pandemic has taken. It was already becoming a national emergency prior to the pandemic, but then it really has been exacerbated and moved at such a higher rate since that time. So the recent study that came out, that 3 out of 4 high school students, they reported that they'd had a traumatic event during COVID that contributed to poor mental health or suicidal behaviors in them. And that this is talked about as one ACE, so adverse childhood experience. And 50% of them had 2 or more. And, this was already something we were experiencing before, but just more ACEs on top of ACEs for so many of these kids, that we know that adolescents who then experience 1 or 2 ACEs are more likely to have mental health concerns and are almost 6 times as likely to have suicidal attempts compared to those who don't. So this is something that we're just so acutely aware of in daily practice. We also know that if we can prevent these ACEs and we can help support adolescents early and give them timely and effective care, we can help them and help change the trajectory for them. Another thing we've seen is increase in suicide. That really, again, was escalating before the pandemic, but has come so much higher now. Particularly, it's been increasing at alarming rates for Black boys and girls under the age of 12. It's now the leading cause of death for Asian American youth. And suicide is now the second leading cause of death for all young people nationally. So it's just such a dramatic increase in so many resources that we need now in terms of mental health for children. Another thing that we've also seen is just the level of anxiety raised in children. There was just a recent task force, the U.S. Preventive Task Force came out and recommended that we now start screening anxiety in all children, starting at age 8 and up. And so really that's speaking to the increase that we're seeing there, so we can identify early children and then give them help that they need early.
These statistics are really gut-wrenching. I mean, where do we go from here?
It is gut-wrenching. I think it's gut-wrenching, and sometimes, to be honest, as a general pediatrician, I feel lost in terms of what we can do. I do not, though, think that this is something that is a lost cause at all. In October of 2021, the American Academy of Pediatrics, so about a year ago, along with the American Academy of Child and Adolescent Psychiatry, declared a national emergency in child and adolescent mental health. And just a week ago, so a year after they put that out, they and 130 other state and national organizations sent a letter to President Biden asking for the administration to declare a federal national emergency in child and adolescent mental health. And so having us really concentrate on this and put resources towards it in terms of mental health resources for students, education resources for the lost learning and increased chronic absenteeism we've seen in kids, other resources for health, financial resources. If we really can think about a holistic approach and wraparound services for children now, and then an investment for them in the future, we can change the trajectory for these kids. We just have to think about the pandemic not being over, but the effects of the pandemic continuing and us continuing to need to invest in these children.
Megan Schutte, thanks so much for joining me.
Thank you so much. And I just want to help everyone remember that, it's our job now not to just help children survive the pandemic and its effects, but really to think about how we can each help each child thrive for now into the future.
Thank you.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.